Dr. McLaughlin, I've been told that I need surgery and I'm thinking about getting a second opinion. Is that a good thing? A bad thing? I don't want to insult the doctor I've been seeing, but this seems like a big decision. How do you feel about second opinions?
Yeah, that's a great question. Second opinions in medicine, and I happen to have an opinion on it. And my opinion on it is that second opinions are important, they're relevant, they're helpful, and I encourage all of my patients to get second opinions when I'm recommending surgery and even when I'm not recommending surgery, because I want them to feel that they've gotten their disease or their problem fully analyzed. Now, if I'm rendering an opinion to someone, particularly about surgery, one of the first things I say to them is, listen, if this isn't an emergency, this is an elective procedure, I encourage you to seek a second opinion. And some people have asked, well, should I go to somebody in your group or should I go to somebody outside your group? I generally recommend going outside of the group and outside of the specialty if you can. So I'm a neurosurgeon. If I'm recommending spine surgery to somebody, I'll typically say go see an orthopedic spine surgeon, get an opinion from a different trained person. Maybe they come to it from a different perspective, and that you may hear a slightly different answer. I don't think you're going to hear a strongly opposed answer from a qualified spine surgeon, but you may hear a little bit of a different answer. And it's important to remember that there's more than one way to treat a surgical condition. Some physicians in their hands are better at doing things from the front or an anterior approach. Others more favor a back-sided or posterior approach. In some instances, some diseases that we treat, the outcomes are equivalent in both approaches. It just comes down to a surgeon preference. So I fully encourage patients to get a second opinion. I think you should be wary of a doctor who's not comfortable with a second opinion, because that means they're not completely secure in what they're saying. I think it needs to be framed appropriately, and patients need to know that they might hear something different that's not absolutely contradictory, and there are more than one way to treat a spinal disease. Now, the second side of that is when I get a patient who comes to me and I'm rendering the second opinion. And for those, I'm very particular. The first thing I say to the patient is, don't tell me what that opinion was. I don't want to know what the doctor told you. I don't want to know what they diagnosed you with. And let's just start with your symptoms. I want to give you a completely unbiased opinion as to what I think needs to be done and what I think is going on. So, and I find that's helpful on both sides, because the patient immediately feels, I think, a little bit less threatened, and also that's exactly what they want to. They don't want to give the surgery away to me because, and I don't want to know what they think it is. I want to really come up with it on my own. And then when I render it, there's two things that can happen. One, it's something that's fairly consistent and they are reassured and comfortable. Or sometimes it's different. It's opposite. It may be somebody got recommended surgery and they're seeing me and I'm saying, no, I don't think you need surgery. In those instances, that's okay. That happens too. It can be frustrating. It can be confusing for a patient. I would suggest in those particular instances, I say go for a tiebreaker, go for a third opinion and see what that other person says. And then ultimately, you really have to choose the person that you trust the most, the person that gives you the best vibe, the person that gives you the best aura and the comfort level. So those are important aspects to think about. Now, if you're going for a second opinion, what are the kinds of questions and research you should do before you seek that second opinion? Well, first of all, I would say you need to really look up the doctor. If you're looking for a surgical opinion, make sure they're a surgeon. Make sure they're not a pain management doctor or an anesthesiologist or a physiatrist who can give you qualified opinions on medical conditions, but they can't give you a fully informed decision about surgery. You need to, if you're thinking about surgery or you've been recommended surgery, you need to get an opinion from another surgeon. That's important. Secondly, look up their credentials, find out where they studied. There are clearly stronger programs and weaker programs out there. So those would be important. Find out where they trained and if they did a fellowship. because a fellowship in spine surgery, in my opinion, is a very important part of your qualifications. It's something that adds an additional year of your training that's focused purely on spine surgery, and I think that's something that's really an extra level of expertise that you're going to get if you get a fellowship trained spine surgeon for your surgery. It's not always necessary, but particularly when you're seeking a second opinion, it's a good pathway to go on. And then, as I said before, I would be wary of any doctor or surgeon that doesn't want you to get a second opinion, that doesn't think it's necessary to get a second opinion. I would strongly urge people to consider getting second opinions. Check out their credentials, check out their training, find out how many times they've done the surgery, ask if you can speak to a patient who's been through the surgery, and if you really can get down to it, see if you can talk to a nurse at the hospital where that doctor works, because the nurses know who the best surgeons are, almost always.